Hi, and welcome to my poster. I'm Elizabeth. I'm a third-year GI fellow at Kaiser Permanente Los Angeles Medical Center, and today I'll be talking about imaging of the pancreas in the new-onset diabetes cohort. I'd like to acknowledge my co-authors for their support. Pancreatic cancer is the third most common cause of cancer-related death in the United States. New-onset hyperglycemia or diabetes may suggest the presence of occult pancreatic cancer. The aims of our study were to assess feasibility and acceptability of pancreatic imaging in participants enrolled in the NOD study. We also wanted to evaluate variability in clinical reports, as well as pancreatic and extrapancreatic findings on imaging. This was a prospective study that took place between November 2018 and April 2020 within Kaiser Permanente, Southern California. Participants between the ages of 50 and 85 with a newly elevated glycemic parameter without prior history of diabetes were invited to enroll in the prospective NOD cohort. NOD participants were then invited to complete a multi-phase contrast-enhanced CT pancreas protocol study. Our outcomes of interest included acceptability, feasibility, as well as findings on imaging. We also wanted to assess variability in clinical reporting between medical centers, particularly noting the presence of descriptors of normal pancreatic duct and normal pancreatic parenchyma. These images were then separately reviewed by an expert radiologist using a protocol to identify specific pancreatic features which were determined a priori. A total of 130 participants consented to undergo imaging. 91 scans were then completed. The median time to imaging was 19.7 days. Median age of participants was 60.8 years, with 37.8% female. The racial ethnic background was as follows. Hispanics were the majority with 41.1%, followed by non-Hispanic whites, Blacks, and Asians. One case of pancreatic cancer was detected, and pancreatic findings were present in 12 of the 91 exams. Of the 3 participants found with pancreatic cysts, 2 underwent further evaluation. 57 extrapancreatic findings were noted among 52 unique participants, the most common being fatty liver. Of the 57 findings, 12 prompted further clinical evaluation. One out of the 8 medical centers was found to more frequently describe both normal pancreatic parenchyma and normal pancreatic duct size. Research reports also noted additional findings of 1 participant with main pancreatic duct dilation and 19 participants with atrophy. This is much higher compared to the 2 that were noted in standard clinical reports. To conclude, pancreatic imaging was found to be acceptable and feasible among participants in the NOD study. There was, however, a high rate of incidental findings, as well as significant variability in clinical reports. Standardization of reporting may aid in identification of relevant pancreatic findings. Thank you so much for stopping by my poster. Feel free to ask me any questions.